Ali Stunt, it seems incredible in this day and age that only 3% of GPs say they're confident to diagnose this disease. Why is the situation so bad?
Well, I have to say, out of our survey of 400 GPs, we expected the figure to be low, but to be 3% of GPs felt that they were confident in recognising the symptoms of pancreatic cancer was really quite shocking to us as well. Pancreatic cancer is difficult to diagnose, but also in that survey, it showed that 90% of GPs thought that pancreatic cancer is a silent killer, i.e. they felt that it's not really a disease that presents with lots of symptoms. We know differently, and people do present with symptoms, and 40% of patients actually will visit their GP 4 times or more before getting a referral.
So what are those early warning signs?
Well, the key symptoms for pancreatic cancer are abdominal pain. It can occur around just underneath the rib cage. It can radiate round to the back. Back pain, mid-back pain, that can sometimes radiate round to the front. We've got change in bowel habits, so people might have pale, smelly, floaty stools that don't flush away easily. Indigestion, a lot of us get indigestion after a heavy meal, but this is indigestion that your doctor may well have given you some prescription medicine to relieve the symptoms of it, and it's not going away. Patients need to go back to their GP if that's occurring. New onset type 2 diabetes not associated with weight gain. This occurs in about 25% of pancreatic cancer cases. And also jaundice, so if you've got the yellowing of the eyes and the skin and maybe dark urine and itching, then you need to go to your doctor straight away.
Now, there could be people watching now who have these symptoms. What should they do?
Well, what they should do is go to their GP and discuss the potential that it could be pancreatic cancer, because that's going to enable the GP to think about pancreatic cancer and rule it out as necessary. They can also have a look on the Pancreatic Cancer Action website. We have got a lot of the symptoms listed there, and there's also a diary that they can take over a couple of weeks, and they can take that diary in and show it to their GP and discuss it. But the key thing to remember is that if you've got symptoms that are not normal for you and they're persisting, go to your GP. If you've already been to your GP and your symptoms are still persisting and perhaps getting worse, go back and keep going back until you've got a diagnosis of some sort.
Now, the death rate from this disease is shocking. Just 4% survive. So what's being done to improve this?
Well, I mean, what we need is funding for pancreatic cancer. It receives only 1.4% of overall cancer research funding, and in 2013 that was a mere £7 million. It doesn't go very far. What we're trying to do at Pancreatic Cancer Action is help inform GPs about pancreatic cancer. We have an e-learning module for GPs that we've co-written with the Royal College of GPs, and it's free, CPD accredited, and takes only 45 minutes to do. But the other thing we need to do is to raise the profile of the disease so the public understands it better. 50% of patients haven't heard of pancreatic cancer before their own diagnosis. We need to change that, and we need to make people much more aware of the signs and symptoms of the disease. We're working on that with major campaigns with Pancreatic Cancer Action, and if anybody wants any information, there's lots on our website.
Ali Stunt, thank you very much for joining us this evening.
Thank you very much.